So it's a inflammatory condition that's the consequence of a prior COVID infection. So as opposed to, someone having a new COVID infection, which for most people is a respiratory illness, but can be, more severe than that. This typically occurs in the weeks after a COVID infection, and it occurs in children. And as the name implies, it's multisystem, it's inflammatory, and it's a syndrome, which means that there's not a specific diagnosis. So you can't just do a test and say that's what this is, but it's the constellation of the history, the physical exam findings, the laboratory findings, all that put together. And it's something that we've been seeing alongside, COVID infections, which in children have been, for the most part, more mild than what we're seeing in adults. But this particular manifestation that, again, is a consequence of a prior COVID infection can be really serious, life-threatening.
How serious?
Well, as serious as it can get. Children who have this condition can die if they're not, recognized and treated appropriately.
Wow. And so how rare is this among children?
Yeah, it's pretty rare. So again, just to kind of contextualize it within, the broader sort of pandemic, we know that kids are less likely to have severe COVID illness than their adult sort of counterparts. And it's really only a fraction of kids who have COVID who will have this. So out of the 28 million people who've been diagnosed with COVID in the US so far, 3 million of which are kids, there have only been about 2,000 cases of MIS-C reported. But of those, there have been about 50 deaths reported. So again, potentially very severe, but at the same time, a pretty rare thing in the context of the broader epidemic.
Do you know why this is happening to children specifically and not necessarily adults?
The short answer is no, not really. It's new enough and it's rare enough that we're still gathering information to really understand what is going on. But what is clear is that COVID or the SARS-CoV-2 virus can cause a lot of inflammation. So even in the adults who have severe COVID disease, who then go on to require intensive care or maybe even die, more often than not, they're not necessarily dying from the infection itself, but from the profound inflammation that comes along with that. And so you can have a lot of inflammation just in the setting of the acute illness, but you can also have it, at least in kids, as a consequence, several weeks to a month after the initial infection as well.
This whole thing is so fascinating to me and disturbing because you think, when you have COVID and you get over it, you think, okay, we're out of the woods, but that's not necessarily the case, unfortunately.
Yeah, and I think that's one of the messages that we should be giving to the community and to providers, healthcare providers who aren't necessarily working at, a tertiary, care, referral center, is that in the aftermath of COVID, so if a child has COVID or if his family has COVID or there's some other close contact who has COVID, that in the weeks after that illness, we still need to be vigilant and thinking about, potential downstream consequences of that. And so if there's unexplained fevers or unexplained other symptoms, like in Richard's case, severe abdominal pain that ultimately wasn't due to appendicitis or anything else, to have this sort of in our mind so that we can go down that pathway and start appropriate treatment as soon as possible.
Yeah. All right. Is there anything else you'd like to add, Dr. Carlucci?
I guess just related to that last question, one thing that might be another, sort of message to folks is, kids, because they tend to have milder symptoms or sometimes have COVID infections without any symptoms at all, this might not be on their primary care doctor's radar, right? Because like we talked about, usually this is something that happens 3-4 weeks after they've had a COVID infection. But if they've not had a clinically apparent COVID infection, then you might not be thinking about it. So in addition to just thinking about the child, it's also important to think about, well, have they had close contacts, family members, other people that they've been around who've had confirmed COVID? Because the kid might have had it as well and just never knew. And in fact, that's what we're seeing in a fair number of these cases where the kid didn't necessarily know they had COVID, but then we do, say, a COVID antibody test and show that they have had COVID in the recent past.